All right. Ready? I'm ready. Okay. Welcome, everybody.
Are you guys gonna be able
Yeah.
to see us from
Yeah.
there? Okay.
Yeah. Now, if you need to move around, there's obviously plenty of seats. Might have a couple of stragglers. If we do, just kind of move in, help them in. Um, yeah, you guys all know me. I'm Dr. Jake. It's my clinic. Um, Fortunately for you guys, this is not my class. So you guys get to learn a little bit tonight from one of the greats, Miss Cheryl Baumfuck. She's bringing to you guys about 40 years of nursing experience, almost 2 decades of teaching experience, and a lot of history both in the hospital and in the classroom as well. So that's part of the reason I brought her in, was to give you guys another voice, another perspective on the 5 essentials and what it looks like from the medical clinical side, as well as just what it means implementing from a personal level. Cheryl's been a patient almost as long as this office has been open. She was just telling me today that when she first started, she wasn't sure if she was joining a cult or not. And in a way, you kind of are, because what we're doing is we're creating a culture of health here in this office. And while I don't want anybody to drink the Kool-Aid or be forced to drink the Kool-Aid, what I do want to see and what I want to commend you guys on is showing up, because that's always the first step to making a change. If you get a gym membership, great, got to show up. You start a diet plan, great, show up to the grocery store, actually buy the food that you need to change. If you're going to start to detox your life, go in there, start removing those toxins, show up, show up, show up. And you guys are already doing that. So good job. I'm going to hand this over to Cheryl, and she's going to start to take this away. So give it up for Cheryl.
Maybe. Okay. So obviously, heart health. Um, Way back when I had a student, and she didn't really want to be a nurse, I don't think, but she said, I have a heart. Why do I need to know all this stuff? Really? You're not going to be successful. So we all have hearts. We all need to know how to take care of them so that we can get the most out of them. Our purpose, of course, is to become the standard of natural health care. And by doing that, we want to empower everyone, you guys, your family, your friends, to live your life to its fullest potential. So, of course, we're going to start. Today is heart health. Actually, February was heart month, but this just didn't quite fit in February. Many of you may have seen these hearts that we had around the office. Disappointingly, we didn't have very many people take the challenge and try to answer the questions. But we did give away a t-shirt to the winner, and that winner did get all 10 right. So we might go through, you'll see the answers to some of these as we go through. Cardiac output is defined as how much blood your heart pumps out every 1 minute. Okay? Your heart, on average, pumps out 5 liters of blood every minute. How much blood does your body have? Well, guess what? About 5 liters. So every milliliter of blood in your body, every drop of blood in your body goes through the heart every minute. And that's just averages. Obviously, if your heart rate's 100 beats per minute, you're going to put out more. If your heart rate's 60 beats per minute, you're going to put out less. If a heartbeat is 80 beats per minute, that's 115,000 beats per day. That's a lot of work to put on that heart. And what do we do for it? Well, we try to ignore it a lot of times. The general population does. So the number one cause of death in the United States is heart disease, and it has been since the mid 1960s. So what happened in the 1960s? Well, that's when heart disease peaked in incidence, and it hasn't gone down. Tobacco use peaked in the 1960s. Ray Kroc bought McDonald's in 1961, and the EKG or the ECG was actually technology that was introduced in widespread use in the 1960s. So, what this means is with the EKG machine, we can detect heart disease and heart irregularities sooner, but we're still not doing anything about it. We're still getting worse and worse. So, what has changed? Well, not much. Our diet's gotten worse thanks to fast food, processed food, genetically modified foods, um, it, pesticides, um, whatever, antibiotics, you name it. Stress, we know everything's gotten more stressful. We live in a busier society. I know in the 1960s, okay, I was born then, which probably you could have guessed. But my mom was a stay at home mom. My mom always had meal on the table at 5:45 when my dad walked in. And it was always, meat and potatoes and veggies and, whatever she had cooked. But guess what? The meat came from her brother's farm, so we knew where that came from. The chickens came from my grandmother's farm, so we knew where that all came from. Um, you know, Mom raised most of her own vegetables in the garden, so very much more healthy and less stressed because the food was there. We weren't there wasn't all those activities. There wasn't the internet. There weren't cell phones. If you wanted to talk to somebody, you had to physically go over there and talk to them. You could use the telephone. And I'll never forget when we started, because we used to have to just dial the last four digits as long as you stayed within the little town. And it was a huge change when, oh my gosh, you have to dial 7 digits now. But that was a step up from the party lines, which I remember those at grandma's too. But anyway, stress. We've gotten a whole lot more stress. And then the toxins, like I have already addressed, all those toxins that are in all those foods. And I did something wrong. Okay, so our future is not brighter the way if we keep going the way we're going. Heart disease, like I said, was started on the increase in the 1960s. Even though we have a lot more technology, we have a lot more knowledge, heart disease and the incidence of heart disease is not coming down. So this is just a study that I found that I really kind of liked. Um, the current trend in healthcare and in cardiac disease, it indicates that the causes of cardiovascular disease are likely to increase substantially as a result of population growth and aging. Okay, kind of makes sense. The more people there are, the older we get, the more likely there is to be heart disease. More people are going to die of heart attacks, strokes, and heart failure and be hospitalized. But it doesn't have to be that way. This was the second part of that same article. Aging doesn't have to mean more cardiovascular disease. Aging or healthy aging without heart disease is our goal. Okay. So cholesterol, we've all talked about cholesterol. We've all heard about cholesterol. What is cholesterol? Okay. So there is good cholesterol. There is bad cholesterol. You've probably heard of your HDLs, your LDLs, and nobody really knows what the difference is, right? HDL is your high density lipoproteins, or as I taught my students, it's the happy one. It's the one that we want to be high because that's the good one. The HDL actually removes the LDL, low density lipoproteins, or the lousy cholesterol, and helps get that out of your system. So, cholesterol in the right proportions is very good. So, here we go. Reasons for a high LDL has a lot to do with what we eat, our diets. Whoops, Did I? Maybe I didn't. So blood pressure. Blood pressure is often called the silent killer because we don't usually know we have heart disease or we don't know we have high blood pressure until we have something else happen, until we have that first stroke, until we have that heart attack or that angina, that chest pain, until we have kidney problems. That's when we realize, oh, by the way, you have really, really high blood pressure. Should have been doing something about it. So, what happens and what causes high blood pressure is that heart has to work harder to get all that blood pumped out. Remember, we said it pumps out 5 liters a minute, and it has to work harder to get all that pumped out because guess what? Those arteries that come off of the heart that take that blood to every organ and tissue all the way down to your big toe, if those get narrowed by plaque or bad cholesterols, then the heart has to work that much harder. As the heart works harder, the heart muscle actually stretches out. And I was asked to talk a little bit about congestive heart failure, so I'll get to that in a minute. So high blood pressure, and if any of you were catching the videos earlier this month, they talked about what causes high blood pressure. We typically think of high sodium diets, which is true because sodium retains water. Water puts more fluid that our body has to pump against, okay? The high cholesterol or the narrowing of those arteries. Stress and anxiety, because what does that do? If we're nervous and anxious and stressed out, that activates our sympathetic nervous system. And the sympathetic nervous system causes some blood vessels to dilate so that I can get blood to my quad muscles so I can run away from that lion that's entering the room. A lot of other blood vessels are constricted, like the blood vessels to my kidneys and my liver and my gut. So they're not getting the blood flow that they need. And if I'm continually in that fight or flight, continually activating that sympathetic nervous system, it's going to raise the epinephrine that is released is going to increase my blood pressure. Because when I'm running from the lion, I need an increased blood pressure. But we don't need to be running from that lion 24 hours a day, unfortunately. So that's kind of what high blood pressure is. The definition, and they keep changing it. Currently, 140/90 is the upper limits of what is acceptable. If you're diabetic, then it's 130/80. If you have a history of some other heart disease, it might be 130/80. Again, those are just kind of numbers that they adjust periodically. And then they adjust the guidelines for treatment based on those. Okay. So here's the slide on congestive heart failure. So systolic heart failure, which you may have heard, systole is when the heart is contracting. And systolic heart failure, the heart can't pump or squeeze enough blood out to get to the whole body. Okay. Diastolic heart failure means diastole is the rest stage of the heart. The heart can't fill with enough blood. So it's got to relax so it can fill up with blood so it can squeeze again and push it all out. So some signs and symptoms of congestive heart failure: extreme tiredness, weakness, rapid changes in weight. And as far as patient education goes, we tell patients with congestive heart failure to do their weight every single day. If they notice a 1 pound weight change, they need to be calling their doctor. Or 3 pounds in a week, they need to be calling their doctor because they're gaining too much fluid, putting excess stress on that heart. Okay, feeling lightheaded or dizzy, here's the swelling. Usually starts in the feet or whatever is dependent. So if you're doing more sitting than you are standing, you're going to get more edema in the buttocks and in the abdomen area. Rapid irregular heartbeat, shortness of breath. Some people with congestive heart failure can no longer sleep in the bed. They have to sit up in the recliner because that's the only way they can breathe, because then gravity will pull some of that excess fluid to the bases of their lungs instead of their lungs when they're supine. They're going to get more uneven distribution. So again, it says over 6 million Americans have heart failure. It is the leading cause of hospitalization. I don't know about that, but I'll take their word for it. I've seen a vast majority of people in places that I've been are hospitalized do have CHF or congestive heart failure. Causes, again, heavy alcohol use, high blood pressure, that's what we're talking about, heart rhythm disorders, diabetes, family history, valve problems, so the heart valves, a heart attack, congenital heart problems, which don't happen very often, and then sleep apnea. All can increase your risk of congestive heart failure. So, what's the solution? The very first action of any physician when they, well, first of all, to diagnose high blood pressure, you should have 3 readings on 3 separate days where your blood pressure is elevated. Okay, that's the standard. Then what should happen next is, like it says, lifestyle modifications. We need to work with individuals. I can work with you guys, your doctor's offices, Dr. Jake, we can all work with you on lifestyle modifications. Guess what? They look a lot like those 5 essentials. Lifestyle modifications. Modify your diet. Get more exercise. Get rid of the toxins. Mindset. And then your chiropractics. Okay. So I guess I just went through the 5 essentials too soon. So heart health nutrition. What do we need to look for? We need to neutralize or even out our fatty acids. Our omega-3 fatty acids are good. Our omega-6s are not so good. Okay. If you have grass-fed, grass-finished beef, free-range chickens, those are closer to a 1-to-1 omega-3s to omega-6s, or I'm sorry, 6-to-1 omega-6s to omega-3s. I always get that backwards. So, and it can be 4-to-1, and that's still considered within the healthy range. So, 4 times as many omega-6s as there are omega-3s. That's still acceptable. What we're talking about in conventional meats is 17-to-1. Okay, 17 times more omega-6s than we have omega-3s in the meals. So think about, if you're going to make, when you make changes, make those changes towards healthier cuts of meat. Okay, if you're a meat eater, healthier cuts of meat is going to be very beneficial. Eggs, again, same thing. You want free range chickens to lay those eggs, as opposed to a chicken who has this 1-foot square cube and they spend their life in this cube. They don't get sunshine. They don't get to be out and about. They're just kind of there laying eggs. Okay. Grains, again, think about what grains you're using. The healthier grains, the oats, are healthier beans, those types of things. Fats, and we'll talk a little bit, I think. Yeah, so this is the omega-6 to omega-3, again, 1-to-1, up to 4-to-1. Diets have kind of been all over the place since the 1960s. Cardiologists decided, oh, we got to get rid of the fats. So everything has to be low fat. Then they went to, well, fats are okay. Let's go to low carbohydrates. Well, now we're kind of in the middle. Don't go extremely low fat, use healthy fats. Okay. Don't go extremely low carb, use healthy carbohydrates, not the potato chips that have been fried in who knows what. Okay. So, again, consuming fish twice a week can result in a 36% reduction in coronary artery disease. And wild caught Alaskan fish is much better, much healthier than the Atlantic, because in the Atlantic Ocean, it's even though it's in the ocean, it's farmed because the fishermen there bait the waters and feed the fish particular grains that the guys in the Northwest don't get. So it's healthier if you can get wild caught Alaskan or cold Pacific. Okay. So I just thought this was interesting, kind of help you know what the omega-3 essential fatty acids are. Again, these are the good ones. So flaxseed, walnuts, navy beans, cold pressed olive oil, kidney beans, green leafies, again, your cold water salmon and pecans. Again, those are just examples of your healthy omega-3s. This is a list of the omega-6s. And if you read down here, omega-6 content of common foods based on percentage of total calories. Grapeseed oil is 70.6% omega-6s. Stay away from that. Here's your soybean oil, your corn oil. Lots of things are fried in those, or we use those a lot. Margarine is 27.9% omegas. Again, we were trying to get rid of bad fats. And of course, everybody thought margarine was a lot healthier than butter. Okay, butter's down here at 3.4% of omega-6s. Again, we want more omega-3s. Bacon grease, lard, those are only 10% omega-6s, so whatever. Anyway, over here in the red, you can see, maybe you can't, coconut oil, whole milk, half and half, ground beef, palm kernel oil, potatoes, yams, canned tuna, much better in the omega-3s, not very many omega-6s in those. Okay. So we do have supplements. We do have the cardiovascular wellness bundle. And so this will help supplement your diets while you are making the dietary changes. These aren't meant for long term. They're meant to supplement until you can make the changes that you need to make. So the cardiovascular bundle you can see is curcumin. Some of you may already be taking curcumin or have heard about it. It is a powerful anti-inflammatory and a powerful antioxidant. And it reduces inflammation, improves immune health and joint health. So again, if we can reduce the inflammation inside those blood vessels, we're not going to get the plaque buildup. We're not going to get the narrowing of those arteries. The CoQ10 is essential in helping to convert those fatty acids, those healthy fats, carbohydrates, and proteins into energy. Okay. I know I've heard it several times. You guys may have too. If you're taking a statin medication to lower your cholesterol, you're probably deficient in CoQ10. The statins stop the action of the CoQ10. So again, you might want to look into those. The next one then is the cholesterol bundle. The cholesterol bundle again has the curcumin in it, which we just talked about. It has red yeast rice with the CoQ10, and this helps reduce cholesterol synthesis, supports a healthy inflammatory response, and it also helps promote healthy blood sugar levels. The plant sterols, which is the third piece of this one, it's in a similar structure to cholesterol, but it can hinder or prevent some of the absorption of the bad cholesterol. So it can help reduce the amount of LDL and total cholesterol in your body because it mimics those other fats so they can't attach and accumulate. Okay. So the high blood pressure bundle, again, blood pressure support. This helps balance blood pressure. It just says through a multiple mechanisms of action. There are things like bonito peptide powder and grape seed extract in there, but it is very good at reducing blood pressure or helping with healthy blood support. NOx support is nitric oxide. It helps relax the blood vessels and it increases circulation. How many of you have heard of nitroglycerin? Take a little nitro pill under your tongue and your chest pain goes away. You know why? Because it dilates the blood vessels. Same stuff this is. Well, if you can take your nitric oxide or NOx support, hopefully you never get to the point where you have that chest pain because we're keeping your blood vessels opened and they're not spasming shut like that. Okay, so those are the bundles. They are all 20% off those bundles. We've got them over here if you're interested. Exercise. Exercise, again, one of those core, one of those 5 essentials. And the more exercise, the better off you're going to be to a point. 15 to 30 minutes a day is sufficient, and it doesn't have to be all at once. If you have your Max T3 bookmark, or if you've had Max T3 before the bookmarks, it stands for time, tempo, and type of exercise. Most of those little exercise sets are about 12 to 15 minutes long. High intensity, and then you rest. And then you hit it hard, and then you rest again. Okay? And that has actually been shown to be more effective than working out for an hour or 2 hours or 3 hours at a day. Okay. I personally couldn't work out 3 hours a day, but some people spend their lives doing that. So here, again, regular exercise, again, 30 minutes a day, at least 5 days a week, can reduce cardiovascular disease between 48 and 57%. So it can reduce your risk by half, okay, or a little bit more. Again, working on that exercise. Okay. So, oops. Mindset. We're going to talk about mindset. What does mindset mean to you guys? The way you think about things. Exactly. What's all going on? So, we've got stress in our lives. We already said stress increases blood pressure, and high blood pressure leads to heart disease. So, we need to work on the stress in addition to the diet and the exercise to try to reduce that incidence of heart disease. So, mindset. Simplify your schedule. If there's something in your life that isn't absolutely essential, eliminate it or do it less. You don't have to totally eliminate it. Make some me time. Okay. You need to do that for yourselves. Breathe to relax. Take a deep breath in and hold it and then relax. Just do that 2 or 3 times when you feel like you're getting stressed. Before you get in the car, before you pick up that phone, if it's somebody that drags you down when you talk to them. If it's work calling, calm down, calm down before you yell at them. Okay. Again, exercise. And that has a lot of effects. It helps clear your mind. It gives you something else to think about, worry about. If you're out there doing burpees or push ups or whatever you might be doing, that's what you're thinking about. You're not thinking about the other 15 things that you need to do after you leave the gym or the pool or wherever you're at. Okay. Yoga and meditation. Again, we do have some workout classes here on Saturday mornings. So you're always invited to join those. Molly does teach some. Dr. Jake in the back teaches some of those. So those are here for you as well. Meditation, whatever you call meditation. So it can be quiet prayer, it can be reading your Bible, it can be sitting, diary. If you're a journaler, sometimes that journal what you've done for the day, journal something, write poetry, whatever is going to give you peace, calm, relaxation. Okay. Doing nothing can be meditation. Get plenty of sleep. And I like the next one, focus on quality sleep, not quantity of sleep. If you can, get 7 to 8 hours at a time. Don't piecemeal it like 3 hours here and 4 hours here. And, yeah, I get 8 hours of sleep in a day, but they're in 4 hour increments. Okay, that's not good for you. You need the REM sleep, you need a certain number of cycles through that sleep process to be able to feel relaxed and rejuvenated. Just another little tidbit, if any of you do take statins, you should take those at bedtime. That's when your body is converting your cholesterol that you've taken in all day, processing it and dispersing it or getting rid of it. So think about it. If you need that 6 to 8 hours of sleep at night so that your body can process. Now, if you work nights, hopefully you can get into a rhythm and work straight nights as opposed to working, and I've done this too long, work 2 weeks of days and 2 weeks of nights, 2 weeks of days, 2 weeks of nights. Your body just gets adapted to the day schedule. Now you go to nights again. If you've got kids, they're never on a day night rotation, and you don't want that. Um, Little ones, uh, my niece had a baby about a month ago, and she said, we are just so excited if we get 3 hours of sleep in a row. Been there, done that. That's part of the reason they give moms 10 to 12 weeks of maternity leave. Hopefully, by 10 to 12 weeks, we've got baby sleeping 4 to 5 hours at a time. And then shift your perspective. So, kind of like we were talking about in mindset, it's kind of what I'm thinking about, how I think about a situation. If I can switch the way I'm thinking about it, instead of saying, oh, the weather, it's going to be bad again today, think about, well, spring's coming, in another week, it's going to be lighter long. Well, maybe it won't be because I think daylight savings time switches on Sunday. But we're going to have more daylight. The temperatures are going to be getting warmer. Try to switch your mindset to a more positive attitude. Write some of those things down as you're journaling to see what that'll do to help you. Then, of course, we need to minimize toxins. We're never going to get rid of toxins. We live in a toxic world. Um, but the less access we can get to toxins, and try to really live as clean as we can. Common toxins, of course, smoking, we all know. And as we said at the very beginning, excuse me, that smoking kind of peaked in the 1960s. So it's not a coincidence that heart disease went up, because what does nicotine do? It narrows your blood vessels, plus all the other chemicals and toxins that you're inhaling. But the nicotine alone causes blood vessels to narrow. Um, Number two is your BPAs, your plastic bottles, plastics of anything. Okay. I don't know exactly. I don't know when Tupperware started, but my guess is it's probably in the 60s as well. I'm not going to blame them, but you know, the whole world went to plastics in that disposable world. And then the last one, which I'm not going to attempt to say, PFOA, which is your Gore-Tex and your Teflons. Those also, it's the number 3 cause of cardiovascular toxins. So think about trying to change out to healthier cookware if you have toxins. Gore-Tex, it's a kind of a material. It's a non-rip material. They used to make a lot of, I don't know if they still do, make a lot of coats out of it. This is the boots, I think, is what's in the picture. Okay. And then, of course, core chiropractic. We cannot forget chiropractics. We talked about, again, lifestyle modifications, diet, reducing some of those, the fats, or making a healthier fats, reducing the sodium, increasing the amount of water. Does anybody know how much water a person should drink in a day? 50% of their body weight in ounces. So if you weigh 150 pounds, you should be drinking 75 ounces of water a day. Okay. It's hard for some people. Some people, it completely wipes out their electrolytes. And then those, they're the exceptions, and they shouldn't be drinking that much. Um, but again, that's water as opposed to anything else. Tea's okay, coffee's okay, depending on what you add to it. If you drink it straight, it's fine. Okay. And then we talked about exercise. We've talked about mindset. We've talked about toxins. Those are the first 4. And then core chiropractic. Um, and as you've probably heard Dr. Jake say, which one of those 5 essentials is the most important? Does it may know? The one you're not doing. The one you're not doing is the most important for you to get started with. Okay. So you're all doing chiropractics. So kudos. You're all breathing. So you're taking in some oxygen. We just need to work on a little bit more oxygen, get a little bit more exercise. Okay. Diet. We're all working on that. We all eat. We just need to work on cleaning it up a little bit. Mindset. Some of us do a little bit better job than others. Some of us are very negative Nellies, and some of us are more happy go lucky. And, pessimists don't live as long as optimists. There's research out there that shows that. So, again, that goes with kind of changing your mindset. We know that the nervous system does control every organ and tissue in your body. So we need that healthy chiropractic, that healthy spine, that healthy nervous system to make this all well worth it. Okay. And you guys are all on the right path to doing that. Okay. So what can we do about chiropractics and heart health? So this is just some research out there that maybe I'll try to read it from here. Um, By adjusting C1, which is the atlas, clear at the very, very top of your spinal cord, blood pressure has been reduced by as many as 17 points. Okay. That's significant when you look at somebody who is, say, blood pressure is 150 or 160, their top number, their systolic number. If we can bring that down 17 points, that almost puts you in the normal range. You know, you're just barely around the 140 range if you were at 160. Chiropractics can improve your lung function. Well, yeah, if I don't have that scoliosis or the kyphosis, my lungs can expand a whole lot more and I can take deeper breaths. If I take deeper breaths, I get more oxygen in. Every organ and tissue in my body is happier. Okay. Another just I'm sorry. Another thought. Ischemia. Does anybody know what ischemia means? Ischemia is my tissue is screaming for oxygen. So if I'm having angina, my heart muscle is not getting enough oxygen. That's what's causing the pain. Okay, that tissue is not happy. It's starting to die. If I get leg cramps when I'm up walking, that's because I'm not getting enough oxygen to the calf muscles when I'm exercising because my calves need more oxygen when I'm walking or running. And if they start screaming, some of you may have heard of intermittent claudication. It's an arterial disease. It's narrowing of those arteries in the legs. Okay, that's ischemia. So anytime you get that kind of onset of pain, think about the tissues aren't getting the oxygen that they need. Um, Chiropractics improves the autonomic functions. Your autonomic nervous system, this says automatic, same thing. Autonomic nervous system means it's things that my body does instinctively without me having to think about it. Thank goodness, because there are some days I would forget to breathe. I would forget to tell my heart to beat if it didn't beat on its own. Okay. We've all had days like that. So we need that autonomic nervous system. My autonomic nervous system tells my organs when to secrete insulin, when to secrete cortisol, when to secrete epinephrine, when to secrete the thyroid hormones. All of those things are controlled by my nervous system, that autonomic or automatic nervous system. And then chiropractics increases heart rate variability. So, with the exercise, with the high intensity interval, we want you to get your heart rate up and then let it come back down and get it up and then let it come back down. Okay. If you can do that successfully, your heart rate goes up and it comes back down. That's heart rate variability. Studies have shown that the more heart rate variability, the better off. That means your heart is able to function, it's able to accommodate for what the rest of the body is doing. And then chiropractics decreases inflammation. It takes some of the burden or strain off of those nerves if you get the spinal cord in the right position, get those bones. So if you get leg cramps when you're sleeping, what causes that? That's usually a magnesium. Yeah, yeah, that's usually a magnesium. Um, so you can increase your magnesium intake. You can, there's Epsom salts, take an Epsom salts bath because that's magnesium and that will absorb into the skin. You can, there's a couple places in town that sell a magnesium gel that you can actually rub on the sore, crampy muscles. Um, Something I learned from an athletic trainer was mustard. take a little packet of mustard that you get at your fast food restaurant, because that's all it takes, and squirt it under your tongue if you like mustard. That will help um, kind of counteract some of the acid that's being released by those muscles.
Have you ever heard of drinking pickle juice?
Pickle juice, yep, same
My
thing.
stepdad swears by that.
Yep, uh-huh. And again, it's the same concept as the mustard. I was going to say that too. If you don't like mustard, try pickle juice, but probably not sweet pickles. That's got too much sugar.
What else? With long drives, sitting too long, same type of thing.
Same type of thing. You need to move those muscles. If you can't, put it on cruise and just pump those legs. Move them. Because not only are you going to get muscle cramps, but you're more likely to get blood clots as well. So put it on cruise. Get out I know you can't get out every hour when you're trying to get somewhere, but at least move the legs around as much as you can to help keep that blood. Because where's the blood going to pool if you're just sitting in the car? It's going to go down to your feet and ankles, and you're going to get more swollen. So avoid those things. Okay. So warning signs of high blood pressure or warning signs of impending cardiac issues, headaches, neck and back pain, sciatica, dizziness, allergies, asthma, sleep problems, hormone imbalance, fatigue, diarrhea, constipation, high blood pressure, high blood sugars, skin issues. Lots of things can be a result. And this doesn't even really talk about kidneys, other than kidneys can definitely contribute to high blood pressure. If the kidneys don't get the blood they need, the kidneys can excrete their own hormones to cause you to raise your blood pressure. Yep.
What effect do kidney stones have
On blood pressure?
on your heart?
Well, the pain that kidney stones cause can certainly increase that sympathetic nervous system, and by that increase your blood pressures. I would say it's going to depend a little bit on what type of kidney stones, because there are 4 major primary types of kidney stones. So if it's calcium, that's a problem. If we've got increased calcium, we've got maybe increased blockages or a narrowing of arteries. If it's uric acid crystals, that's gout. And that doesn't it can, because you can get those gout crystals forming in your heart valves as well, and in your blood vessels. So all of those, they don't just have to be in the kidneys, but those stones can form in other places besides the kidneys, wherever there is an increased concentration of those particular chemicals or electrolytes. Yeah. So what do we need to do? Let's see. So make an appointment. That's preaching to the choir. You guys all have appointments made. Action steps. We need to take some action steps here. And everybody's got something to write on or something to think about. Make some SMART goals. Okay. If you haven't heard of SMART goals, it's specific, measurable, attainable or achievable, relevant or realistic. I use that one too, and timed. So I'm going to start eating more fish is a horrible SMART goal. Okay. I'm going to eat wild caught fish twice a week within the next 2 weeks. Okay. That's going to give me time to get to the grocery store, get the fish, figure out how to fix it, and within 2 weeks, that goal should be met. Okay, it's specific. We know what we're going to go buy. We know it's measurable because in 2 weeks I can come back and say, did I do it or not? Is it achievable? It should be achievable, obviously. Is it realistic? Yeah, it's realistic. And is it time? Yeah, yeah. And if you just say, I'm going to eat more fish, it's not specific. We can't measure it. Is it achievable? Well, what are we trying to achieve? We don't know, we don't know. Is it realistic? Well, yeah, but it doesn't have any of the other components of it. Uh-huh.
Are certain types of fish more beneficial than others? Like, I have a friend that really pushes salmon.
Salmon's good. Salmon is good. You don't want, think about what does your fish eat? Okay. So shrimp are kind of the bottom feeders. They get what's on the bottom, what's kind of the leftovers from everybody else, and they're not real healthy. Okay. Salmon, good. Again, Alaskan wild caught is the best. Um, Tuna, I've heard tuna is not the best because of everything that the tuna fish eats. Um, there's a lot of mercury in the tuna. Um, so again, look and see what's in your tuna before you eat it. A can of Star Kissed probably isn't as healthy as if you were to get a tuna. Is it a high tuna or something like that? Something like that. That's going to be better for you again than the processed pieces of tuna that they stick in the starfish can. Okay. They're a good healthy source of fats. Um, again, they're kind of the bottom feeders. So you got to think about what do your sardines eat before they get to you because you eat what they eat. So keep that in mind. Okay. So upcoming events. We have on March 15th, we have our Patient Appreciation Day. So come in and see what activities or festivities or fun activities we're doing. That is a Wednesday, so it's a long day. I mean, we'll be open both morning and afternoons. March 20th, which is on a Thursday, I'm going to be doing a 5 Essentials class. So we'll dive deeper into the 5 Essentials. So if you haven't been to a 5 Essentials class, that would be awesome. If you have been and want a refresher, that's fine as well. Essential oils class, that's March 27th. So if you have a doTERRA membership and you want to learn more about how to use those oils, if you're just curious and want to know a little bit more about the doTERRA oils, I'm going to be teaching that one as well. We do not sell doTERRA oils here, but we can help you get a membership so that you can purchase it at a lower price. Okay. So those things are all on the calendar in the back. Looking forward, April 11th is a community dinner. And so we would like all of you to bring a friend or a significant other, somebody who is not a patient here currently. And we'll kind of do a wrap up of, I don't know what talk we're going to give that night, but Dr. Jake will figure that out, what topic he wants to talk about. But it's a dinner for you and a guest. It will cost you $20 if you come by yourself. If you bring a guest, it's free for both you and your guest. It's included in your care plan. And then April 24th is Terminate Toxins. So that's the title. I haven't seen too much more information on it yet, but that's our April workshop. So, questions? Mhm.
What effects do diabetes have on heart health?
Well, what effects do diabetes have on your blood vessels? They make them more fragile. Um, I don't know if you've heard of, and you may not have, but metabolic syndrome. And metabolic syndrome is actually a group of diseases that tend to run together. And that's what the word syndrome means, is a bunch of diseases that run together. So if you have diabetes, specifically type 2 diabetes, if you have high blood pressure, if you have high cholesterol, or if you have an enlarged waist measurement, you are more likely to get the other three. So, patients who are diagnosed with diabetes are very commonly started on a statin to lower their blood cholesterols. Even though their cholesterol may be fine, the research shows that their cholesterol might go up. So let's put you on a statin to prevent that from happening. Okay. They're going to watch your blood pressure closely because, again, you might have high blood pressure. They won't start you on a blood pressure medicine when they start you on your diabetes medications, but they'll be watching it closely. And then what are they going to tell you? Diet and exercise, lose weight. Walk 10,000 steps. I love that. Walk 10,000 steps a day. Are you kidding me? The way my knee hurts or my back hurts or my neck hurts or whatever it might be, I can't walk 10,000 steps, but that's the routine. That's the advice, the medical advice. It's not individualized at all. So, okay. You don't have one. What that does is it entitles you to 5% off of any supplements throughout the year. And everybody who has their Wellness Warrior card today got a punch last month. You'll get another punch tonight. That each punch gives you an extra 1% off. So you could potentially, by the end of the year, get 17% off your supplements. Okay. If you don't have one, talk to Dr. Jake. If you were here, it must have been January, was our last one. We can get you one to start out today and get your first punch tonight. The sauna, we'll talk about that. Nope, it's in here. I thought it was in here. I lost it. Sorry about that. I thought it was in here. The sauna, if you buy any of the two bundles, either the 4 visits for $50 or the unlimited 1 month use for $100, you'll get one punch for the $50. You'll get 2 punches for the $100 bundle. If you do that, and 15% off any supplements today, plus your Wellness Warrior discount. And the bundles are, if you buy any of those 3 bundles, the cardiovascular bundle, the heart health, cardiovascular, high blood pressure, and cholesterol bundles, those are 20% off tonight. Okay. Questions? Comments? Okay, everybody learned something. Okay, quiz time. Okay, the beating sound of your heart comes from where? A, the blood going the wrong direction. B, the valves closing, C, the heart skipping a beat, or D, your ears are just playing tricks on you. B, valves closing. The basic function of the heart is to pump blood throughout the body to A, deliver oxygen to the tissues, B, deliver nutrients to the tissues, C, remove carbon dioxide, D, remove waste products, or E, all of the above. E, all of the above. Your heart pumps about how many gallons of blood every day? This is a trick because I gave it to you in liters. Your answers are 20 gallons, 200 gallons, 2,000 gallons, or 2 gallons. 2,000 gallons. These tubes carry the blood back to the heart. A, arteries, B, veins, C, pipes, or D, tubas. B, veins. What organ removes wastes from the blood? A, the heart, B, the lungs, C, the eyes, or D, the kidneys? Kidneys. LDL is, and this is a select all that apply. My students hated these. A, low density lipoprotein. B, should be greater than 200. C, nicknamed bad cholesterol. D, helps remove the HDL cholesterol from the body. C is one of them that's correct. Yes, it's nicknamed bad cholesterol. A, it's low density lipoprotein. Okay. LDL should be less than 100, not greater than 200. And the LDL is removed by the HDL. Okay. According to the CDC, this one should be easy for everybody. The leading cause of death in the United States in 2020 was A, diabetes, B, COVID-19, C, heart disease, and D, cancer. Heart disease. What is the name of the wall that separates the left side of the heart from the right side of the heart? A, ventricle, B, atrium, C, septum, or D, the great wall? The septum. You can keep your heart strong by A, eating heart-shaped candy, B, doing activities like playing outside, riding your bike, or swimming, C, smoking, or D, sleeping 18 hours a day. B, doing activities. And then just some fun facts. The giraffe has a lopsided heart. The left ventricle is thicker than the right because the left side of the heart has to get the blood up the giraffe's long neck. Just kind of an interesting little tidbit. High blood pressure or hypertension contributes to heart disease. Some of the symptoms include, and it was on one of these slides, but blood spots in the eyes, dizziness, fatigue, confusion, pounding in your chest, ear, or neck, chest pain, and facial flushing. The human heart weighs about 10 to 12 ounces for men, 8 to 10 ounces for women, or roughly the size of a large fist. And other animals don't have heart attacks, not even chimpanzees. Other animals do experience cardiac problems, though, just don't have heart attacks. So, a little FYI there, okay? Okay, thank you guys for coming. Yep, one more.